Hi, everyone, and welcome to the Muslim Sex Podcast. I have some exciting news. I want to let all of you know that I am opening up my office, my private office, where I can see you here in New York, and it will be opening at the end of this month. So this month is now June. So at the end of this month, my office will be up and running, and I would love for you to come in and see me as a patient. So go to V Health, so that is FEMMEVIEHEALTH.com, and sign up to be a member of my concierge gynecology practice. And you can also come to see me for regular visits, or if you have a problem visit, come and see me. I, of course, focus on menopause and sexual health. So if you're having any of those issues, I'd love to see you. And make sure you come in and say hi. I'd love to meet you in person. So also, the retreat is still going on. It'll be happening September 16th through the 23rd, and we only have a few spots left. So if you were thinking about coming to the retreat where we focus on nutrition and sexual health and menopausal health, you need to register today because spots are filling up. And once it's sold out, it will be sold out and we will not be taking any more participants. So make sure you go and register for that as well. Also, as always, please remember to like and share this podcast. Leave me a 5-star review so that it shows up and so that we can get the word out about menopausal and sexual health, as well as intimacy and intimacy coaching. So if you love this podcast, please make sure to leave me a 5-star review. And now on to the episode. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about chronic pain and how to get the treatment that you deserve and could probably use. Before I get into the first thing I want to make very clear is I'm not giving any type of medical advice. If you have any questions about chronic pain or if you're suffering from chronic pain, please be sure to go see your primary care provider that can help you out. And this episode or any of my episodes are definitely about religion. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm very excited to have on with me Dr. Sarah Merritt, and I will let Dr. Merritt introduce herself.
Hi, thanks for having me. My name is Dr. Sarah Merritt. I'm an anesthesiologist and pain medicine physician, certified in both of these. And my practice is in Bowie, Maryland. It's called Lifestream Health Center. And we see patients with acute and chronic pain. We're really on a mission to make pain management more caring and accessible, patient-centric and evidence-based. And so that's really what we're about, connecting with people and just raising the bar in pain management care.
Awesome. So, as you know, on these episodes, we usually talk about the specialty of the physician and how that relates to intimacy and relationships. And so I'm curious to know what type of pain that you will see, either, if it's coming from, let's say, from women or from men. What are the typical things that bring patients to you?
Yeah, I would say I see my practice skews a bit female. I do see men and women. I probably have maybe 60% women, 40% men in my practice, and probably most over the age of 45. But I see the full range, even from 18 or so. Sometimes we see very young people with certain types of whole body pain conditions or nerve pain to elderly people too. And, really in pain management, a lot of times we're helping, of course, to diagnose and treat a pain problem that a patient might have. And in that journey, really we're looking to improve their quality of life is a lot of times one of the big goals. And even if we can't, sometimes we can eliminate a person's pain problem, but other times we can't. And if we are looking to help people live with it, than optimizing quality of life. And so, being here to speak with you, sexual health obviously is a big part of quality of life for many people, and something we don't want folks to lose out on just because they might have a pain condition.
Right, absolutely. So when people come to you, are they coming for like endometriosis, chronic pelvic pain? Are they coming for, what types of diagnoses do they usually seek out?
Yeah, it's a variety. I mean, I see some of those conditions for sure. Endometriosis and pelvic pain are not uncommon. The other interesting thing is a patient might initiate care with me around headaches or neck pain or a different part of the body. But what we actually know about people with chronic pain is that it's not uncommon for people to have more than one pain condition. And so that same patient who might have a herniated disc in their neck or have had a chronically painful problem um, in the neck area, might also have pelvic pain from endometriosis or another type of pelvic pain. It's just not uncommon at all for us to see patients that have more than one problem. Pelvic pain is often one of them.
Yeah, I'm wondering if, sometimes you also get pain radiating, right, in different like dermatomes and things like that, depending on, for example, we know that it's people that have sciatica, right? Their pain goes down the back of their leg, and sometimes it can be like in their big toe or something like that. L5 usually is the big toe, isn't it? I'm trying to remember
Right,
my
right.
dermatomes.
Yeah, L5 would be often the big toe. That's right.
Yeah. So, but anyway, so I think that sometimes we may not know, right? Patients may not know what the cause of that pain is or where it's coming from originally, but they may just have that pain in their big toe and realize that it's
Right.
actually from a nerve root higher up.
Yeah, and that's what they're really seeking usually with the physician, right? That's the the diagnosis aspect is figuring out what the problem is, and so very often we do get patients who are maybe referred from another physician, their primary or another specialist, and so they may have a diagnosis. We may have a pretty good idea, but then there are other times that we don't, and so. It's just a variety of things, and there's times we need to do workup maybe on new pain problems where a patient may have pain. For instance, I saw a woman this week who was having some sciatica type of pain, some discomfort in the leg below the knee on her right side, and it was a little unclear what the source was. And so she'd had an MRI, and so we discussed, the ways that we could assess, was this from the low back? Her MRI was actually not that exciting in terms of showing a clear cause for this sciatic type of problem. Um, and so how are we going to figure that out? Sometimes that's the mystery or the thing that we're tasked to do in pain management is to work with the patient to confirm a diagnosis and find a treatment plan.
Sure, sure. And so what about, the types of pain that you have people coming for? So you did mention like endometriosis or chronic pelvic pain. Do they ever discuss with you how that affects their relationship or, is it causing a lot of times people will be suffering with these conditions for a long time, right? And so then they eventually go, a lot of times I think people tend to go to perhaps their gynecologist first to figure out what the cause of their chronic pelvic pain is. But once they get a diagnosis, a lot of times, and if the traditional medications don't work, or, we try to suppress their ovaries if they have endometriosis, or, trying to come up with reasons for why they may be experiencing all that pain. At what point do you see them? Like, is it they get referred out by the gynecologist and then they come to see you?
Yeah, I think it kind of varies. I would say that, in terms of many gynecologists who do work with pelvic pain, they do want to provide that comprehensive care. And so more often than not, in my experience of working with the gynecologists in my community, I do get some referrals, but a lot of them are really doing, frankly, a pretty good job of managing those patients on their own because, of course, they have the knowledge base and skill set. And the gynecologist very often for those patients who might have pelvic pain, for instance, we sometimes are referred patients for things like nerve blocks. Well, often in gynecologic care. If there was a concern for maybe pudendal neuralgia, most gynecologists would be pretty comfortable to just go ahead and do that nerve block themselves, right? If they want to work up that condition, they might do that in their treatment algorithm. So very often that can be part of what we do, whether for pelvic pain or for other parts of the body, might be considering, nerve blocks or those types of treatments as, would they be helpful for diagnostic and possibly for therapeutic purposes also.
Sure. And what about for men? I mean, I'm sure there's lots of, conditions you see both genders for, but are there any specific one that relates to intimacy for men that you sometimes will see?
Yeah, that's a good question. I have had the opportunity to discuss intimacy with some of our male patients, and it definitely comes up really for men and for women. Um, for I can think of a particular patient that I treated in the past and who's really still in my practice. And he had a pelvic injury in the course of his work as a police officer, and went through some years of treatment and, in particular, nerve blocks and things with prior pain management before coming into our practice. So I would say, in that case, it was really post-traumatic, right? This was a person who'd had a specific injury. I've also had an interesting case or two where patients had like a nerve pain disorder where, say, in association with climaxing, like during sex, a particular patient who had CRPS or complex regional pain syndrome and would just experience these much, much worsening pain symptoms in his knee with sex.
Wow.
And
So
in
very,
this condition, CRPS, complex regional pain syndrome, which is really, kind of a problem with the, connection and mapping of the, maybe the pain or sensory nerves to like the hand or the foot or the knee in this case, when the wires are crossed, maybe so to speak, that the connections just aren't quite what they should be. And in this case, this patient had an unfortunate situation where, when he was being intimate with his wife, he would have these just extreme pain episodes.
that's interesting. So was it with orgasm that he was having that pain or oh, it was interesting. So then what were you able to do for that? I'm curious to find out now. I'm like invested in this story.
Right. Um, really, we ended up treating his baseline CRPS. And so for this particular pain problem, there's a treatment called a sympathetic nerve block. In his case, it was the lower extremity. So we did a lumbar sympathetic nerve block, but you can also do a upper body sympathetic called a stellate ganglion block. And so we did this stellate ganglion block, or excuse me, we did this lumbar sympathetic block to decrease some of that sympathetic outflow to the leg. And while it didn't seem to resolve the condition fully, he did tell us that between that and we also had prescribed him some gabapentin for nerve pain, that between the two of those, he did end up getting some symptomatic improvement.
Wow, yeah. So, when we work up for sexual health, even when we work up pain, in terms of, let's say, patient is having pain with orgasm or pain with intercourse, penile vaginal intercourse, what we'll do is we'll go through like the different regions of the spine and actually have a podcast episode with Dr. Erwin Goldstein. So for those that didn't listen, you should go back and take a listen. And he talks about the different regions actually in the spine and how it is related to sexual pain and how the different regions can manifest. And so you start with the lower region. I think he calls it like region 1, region 2, region 3, region 4, and region 5. And each region has divides up the spine into, like, for example, one region is just like the whole external vulva and the genitalia, and it goes all the way up to basically the CNS, so the brain and based on wherever the pain is coming from, you try to figure out how the spinal cord may be related. I mean, it's not always the spinal cord, right? We always do like a thorough exam first. We make sure that there isn't anything anatomical going on. You and I were talking a little bit offline about Tarlov cysts and
Hmm.
how they have been seen for in some patients that have persistent genital arousal disorder, where they have arousal that does not go away with orgasm. And a lot of patients that have this find it to be very uncomfortable, and they are actually, a lot of times, they're very upset. It can lead to depression. Some patients actually have committed suicide. For those that are not able to get treatment and don't know where to go to get help for persistent genital arousal syndrome. And so, disorder, actually. And I know that a lot of times when we have this, one of the key things that a lot of sex med docs will do is get an MRI of the spine, and they'll see that Tarlov cyst. And I think you were mentioning that too. And actually, it requires a specialist to go in and actually take those cysts out, because not everyone wants to go in and mess around with the spine and the nerve roots in the spine. And so you have to go to a specialist that actually knows how to remove those. But then once that cyst is removed, because it's pressing on those nerves that's causing that arousal, those patients do great. I mean, they have complete resolution of their symptoms and they feel amazing. But oftentimes that's overlooked, and a lot of practitioners don't even know about that. So you were mentioning a case that you had.
Yeah. Yeah, so I've seen Tarlov cysts for years. And in fact, when I did my training in pain medicine at Johns Hopkins, one of the neurosurgery attendings who was retired at that point and really just enjoying a retirement project was looking at ways to treat Tarlov cysts with like a fibrin glue, and like, would it be possible to clog off these cysts with some glue? Unfortunately, like, that hasn't caught on as a mainstream therapy at this point. Like, as you mentioned, there are times that patients will have symptomatic Tarlov cysts, and there are treatments available. Very often, when I see patients, there's probably an element of pain if patients have Tarlov cysts. And so some people will have, depending kind of on where those cysts are pressing, they might be causing sciatica type symptoms that might be relieved by something like an epidural steroid injection. At other times, depending on the area of the spine that they are stimulating, they've been known to cause this persistent genital arousal disorder. Um, and so one of the recommended treatments, and where we've interfaced with those patients in the past has been also for something like an injection, like often an epidural steroid injection, where we might introduce a needle in the lower part of the spine where the Tarlov cyst may be, to help as like really a diagnostic and a treatment modality. If sometimes we can get transient or long-term relief from an injection and help a patient avoid surgery, we're always glad if that's possible. But other times the shot or an injection might be kind of part of that diagnostic workup to move a patient toward potential for a surgery that might be able to resolve the problem in a surgical fashion if other things aren't enough.
Yeah, yeah. And I bet, once you're able to get that epidural in that region where the cyst is, and if the pain goes away, then you know that that's definitely the cause of the pain. And so that's probably a reason why it would move them towards surgery, because you know that it absolutely needs to be removed so that they can have some remission and some relief from that pain.
Yeah, it's always satisfying to be able to provide that, but that's right. Like, sometimes it's a long-term solution, sometimes it's a short-term solution. It's challenging, for me as the person doing the injection, because it's hard to guarantee that long-term outcome. Some people will get a long-term outcome from an injection, and we're always hopeful. But when they don't, then it can be a compelling case to consider some of the surgical options that are out there.
Sure, sure. Yeah, no. So I think that that's really important for those that are listening, is that if you are suffering from chronic pain, then it's definitely helpful to go to somebody that specializes in chronic pain to help alleviate that, so that you can improve your quality of life, right? And I'm sure that's probably why a lot of people come to you, is that a lot of their chronic pain is very debilitating, and they probably are not able to go ahead and do things that they need to do for activities of daily living. And so, maybe it causes a lot of pain. And so they come and see you for that.
That's right. That's right. Yeah, I think that's really the place that we're able to have the most impact is helping patients with their quality of life and being able to live life better. That's really one of the things that's important in my practice.
Yeah, I think that's fantastic. So, what are some of the other things that you deal with? I know you said chronic, like head pain and neck pain and things like that. Any other issues that you see regarding intimacy with patients, or that you have seen or treated, and maybe any stories that you may have on how that improved, after they saw you for their chronic pain?
Yeah, I think it's been pretty consistent over the years that probably a lot of what we see is spine pain, frankly. And back pain, because back pain is just a very common condition. I think the statistics are around 60% of Americans will have some level of acute back pain in their life. Like the majority of people will have some type of episode of acute back pain that's debilitating for at least a short period of time, and then for some patients that becomes a longer period of time. So the challenge with back pain in particular is really just that it's hard to do much movement in your body without moving the back in some way. And really the pelvis, again, is also
Yeah.
intimately connected. So often for our patients with significant back pain, if we can help them do better and move more, it's not uncommon, especially with my male patients, but with female patients too. If a person has enough back pain that they're coming to seek medical treatment with a pain doctor, they're very often probably not engaging in intimacy, or they're less interested or less prone to initiate intimacy due to pain, and it's been more common than you realized for people, when they're telling you that they're better, that's really one of the measures, frankly. and
Yeah.
and I think it's back to that quality of life question, right? Because just to be able to do the things that you want to do, whether it's being intimate with your partner, or walking the dog, or getting groceries, just all these things that are kind of easy to take for granted. If you don't have a significant pain problem, they can suddenly become very challenging if you have a significant amount of, say, back pain or pelvic pain.
Yeah, absolutely. I mean, I can't, stress that enough. I think that definitely people that suffer from back pain and definitely any type of pelvic pain, you're absolutely right. They're definitely not engaging in, being sexually active, because we know that anything that causes pain, you're not going to want, right? So if you have pain every time you try to initiate intercourse, it's probably not something that you're going to do too often. I have a lot of women that come in in menopause, and that are experiencing pain with intercourse. And so they're definitely not having intercourse because of that pain. And they don't realize that something as simple as vaginal estrogen can help get relief. They can have some relief with the vaginal estrogen and help that tissue in the vagina. And improve their vulvar health just with that simple prescription of vaginal estrogen. So absolutely, I can see how, if somebody's experiencing chronic back pain or chronic pelvic pain, that they're definitely not going to be intimate. And so, think about how many lives and relationships you're saving, right? That you're helping with what you do, because it's definitely, it impacts their quality of life. And we know that sexual health is part of a patient's overall health. So if they are, and like you said, it is a barometer of a relationship, right? And we
Mhm.
know that one of the top 10 reasons why people will get a divorce in the US is a sexless marriage. So,
Mhm.
and we know that you don't have to be physically intimate all the time, but I think a lot of times when you lose that physical intimacy, the emotional intimacy also goes away, and then all the other forms of intimacy, so that you feel like you no longer have a connection with that person anymore, and then you have resentment and anger and all these other things that sometimes can happen in a relationship if you're not with a very supportive partner.
Yeah, I would share that to that point. sometimes when I've helped somebody, and if we're at a point of a visit where the patient says they're basically doing well, I can think of more than once that a person and their spouse has been there, and they'll really say, and my spouse thanks you too.
Yeah,
If
that's
they've
great.
improved, and partly, I can think of a couple different conversations where at least once it was, yes, this is definitely about sex, and that's really it. But then also just the mood, right? That one's
Yes.
mood and just ability to interact productively with your partner, right? Because
Absolutely.
I think you've said this before. I mean, I think sex starts outside of the bedroom, right? That there's
Yeah.
all these interactions that we have in day
Yeah.
to day life that can help, things go well. And I think it
Exactly.
has to start with just your regular interaction with your partner.
Yeah, 100%. And I love the fact that you brought up mood, right? Because we know that obviously, if you are experiencing chronic pain all the time, it's going to absolutely affect your mood. And you're not going to want to perhaps even, talk to your spouse or your children or anything like that, right? If you're in chronic pain, perhaps you're in bed, perhaps you're not able to walk, perhaps, there's so many different ways that chronic pain can affect a relationship and family life. So, I think that once you're able to get that relief that you need, then it will really improve your whole life. And I'm so glad that you are doing that for so many patients and so many lives you're improving just because you're helping them with something that they've had to deal with perhaps their whole life, right? Who knows? Sometimes it happens acutely, like you said, with that police officer that experienced that pelvic fracture, that pelvic pain. But sometimes it can be a chronic condition that leads patients to experience so much pain.
Absolutely. Yeah, there's just so many things that can lead to that, and not to mention, just trauma and the how a problem came about. In my practice, frankly, we treat a lot of patients with workers' comp injuries or car related injuries, and that idea that you've been victimized in some way can be very negative, um, and that affects the patient's own mindset around the problem.
Right, absolutely, absolutely. And I talk a lot about how, your thoughts then lead to your feelings, which lead to your actions. So if you're if you're thinking that, I'm useless or I can't do anything anymore and I'm not helpful, then the feelings that you may get are those of like perhaps resentment or anger or hopelessness. And then the actions you take, maybe you don't go out, maybe you don't mingle, maybe you don't interact with your partner, your family, your relationships, all that, and everything suffers, right? So if we can improve that mindset and improve the thoughts that a patient is having, then, it will eventually trickle down into their relationships and hopefully improve that as well. And by taking care of patients that have chronic pain, I personally feel that patients that have chronic pain are some of the most difficult ones to kind of figure out and help and assist and get better. And so I think it's fantastic that there are people like you around that are there that can kind of help and collaborate and uh, perhaps even take over patients that are experiencing so much pain, right?
Yeah, thank you. Yeah, it's really impactful, when we are able to help people, for a lot of my patients, they might have, half a dozen significant medical problems, but they may feel like their pain problem is the biggest one, or because it has so much impact on their quality of life and on their mood. It really, on a personal level, really feels very impactful when you're able to help connect with somebody and then help move the needle for them with their pain.
Absolutely, absolutely. Well, I think it was fantastic what you do. And so, for those people that are watching and wondering where you are and where they can get help for their chronic pain, whether it's pelvic or otherwise, how can people get in touch with you and where can they find you?
Absolutely. My name is Sarah Merritt. My practice is called Lifestream Health Center. We're online at lifestreamhealth.com. You can reach us at 301 860 305. We're taking new patients.
Awesome. Well, thank you so much. And I really appreciate all that you do because I think it really impacts patients' lives and it really makes a big difference in how they feel about themselves and how they feel about interacting with others. And really having that mobility and that access to pain relief is so important for so many people. So thank you.
Thank you.
And well, we are done here, and it's been real and really intimate. And remember, of course, this is not meant to be medical advice. So if you're having issues with chronic pain, whether it's pelvic or with your head or with anywhere, make sure you go see your primary care doctor or reach out to Dr. Merritt, because she is definitely available and open to helping people. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.